Hello guys, I have a question for you. A patient is rushed to the ER with a severe septic shock. Blood pressure is 80/40. To save their life, you need immediate massive vasoconstriction. So, which specific adrenergic receptor are you targeting right now? You will learn the answer to this question after watching this video. Welcome to Synaptopedia. Today we will be talking about alpha receptors of the autonomic nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. We have two systems. One, sympathetic, and two, parasympathetic. Sympathetic nervous system means fight or flight, so an alarm situation exists. Parasympathetic nervous system means rest and digest, so a relief situation exists. Let's look at the receptors. Our first receptor is Alpha-1. When we think of Alpha-1, the first word that should come to mind is contraction. Just like a blood vessel constricting from this state to that state. Let's set up the equation then. Alpha-1 equals contraction. But how? Alpha-1 receptors are GQ coupled and increase intracellular calcium, thus causing vasoconstriction. This results in increased blood pressure, so caution is advised. We mentioned contraction for Alpha-1, right? Yes, because we are not done with the contractions yet. This is a normal eye, and this is a normal radial muscle. As a result of Alpha-1 receptor stimulation, the radial muscle contracts and shortens. And because the radial muscle shortens, the pupil dilates, resulting in mydriasis. Let's set up the equation then. Alpha-1 equals mydriasis. But how? Remember that the Alpha-1 receptor was coupled to GQ. Intracellular calcium increases and the radial muscle contracts, moving from this position to that position. This results in increased intraocular pressure, so caution is advised. Our next receptor is Alpha-2. When we think of Alpha-2, the first word that should come to mind is inhibition. So, how do we remember it? Don't worry. Let's say Alpha-2 takes 2 steps back. Let's set up the equation then. Alpha-2 equals inhibition. Let's continue with the things that Alpha-2 receptors inhibit. Alpha-2 receptor stimulation acts to sympathetic transmission is inhibited, insulin release is inhibited, and lipolysis is inhibited. But let's ask the question, why? Alpha-2 receptors are GI coupled, and the adenylate cyclase enzyme produced cyclic AMP. Activation of Alpha-2 receptors stimulates the GI, which directly inhibits the enzyme adenylate cyclase. As a result of inhibition, intracellular cyclic AMP levels drop and resulting in inhibition. Let's set up the equation then. GI equals Inhibition. Now, let's go back to outpatient in the ER. Diagnosis is septic shock, check. Blood pressure is 80/40, check. And we needed immediate vasoconstriction, check. Based on everything, we just covered the correct target is Alpha-1 receptor. Congratulations! And then brings us to the end of today's topic. Now that you have mastered the core functions of alpha receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Which alpha receptor is primarily responsible for triggering platelet aggregation? I will be waiting for your answers in the comments. See you later.